Now at 4, your community focus, we're talking COVID-19 today with Dr. Jim McDonald from the Rhode Island Department of Health.
He joins us every week right here on 12 News Now at 4. Dr. M, thanks so much for joining us.
No, it's great to be here, and Happy New Year to both of you today.
Happy New Year to you. A lot of news so far this week. Coronavirus still here, so let's dive right in on that topic. We are hearing now the FDA is considering cutting COVID-19 vaccine doses in half to vaccinate more people. Is this a good idea?
You know, I think we have to wait and see what the data shows. I mean, part of what I just think is really important for Rhode Islanders to understand is if we're going to give you a vaccine, we're going to make sure it's safe and it's effective. So when we see the data in Rhode Island that it's safe and effective, we'll have that conversation with you and you won't be surprised. So let's wait and see on that one.
Dr. M, we've heard a lot about the cutting edge technology that this vaccine utilizes. You and I have talked about it before, how it doesn't actually have any of the virus itself in the shot. So I'm wondering, are we going to see this technology employed to combat other viruses, maybe like the flu?
I think you're going to see this technology in not just other vaccines, but in other aspects of medicine. In other words, I think when you look at treatment of other diseases, perhaps even cancer, this is where there's research ongoing. This stuff is going to be years away, my friends, but I think this is one of those things where this is where the technology is bringing us, and I'm kind of excited about it. I did a lot of molecular biology in college and medical school. I am so glad it's finally paying off. This is fun to see this.
Dr. McDonald, there is also a report today out of Connecticut that the new variant of COVID-19 has been detected there. Anything you can update us on or whether it's being found here in Rhode Island yet?
Yeah, we haven't found it yet, but we're looking for it. And what we're doing by looking for it is we're looking at past specimens and we're looking at current specimens, and we're going to be doing some surveillance for future specimens. And I think it's just important to understand that we're going to find it eventually, is my guess, right? And so Connecticut's not that far away. We share a border, right? So the same strategies we use to prevent COVID will work on the variant. It's just more contagious, which is another reason to make sure you're doing what you're supposed to be doing.
Dr. M, I want to pivot to the topic of testing. The FDA warned earlier this week that there's a risk of false negative results from some COVID tests. So what should people know about that?
Yeah, no, we don't have that particular test in Rhode Island, but I think it's important to know that about every test we do, no matter what test we're doing, whether it's for COVID or any other disease. A false negative means it said you didn't have the problem, but you really did. And it's funny how we name these things with these odd little names here. So that's one of those things where if you're still having symptoms, you want to say, maybe I have to think about that. But the tests we use in Rhode Island are really, really good. And I think this just underscores why it's so important that it's a redundant system, right? If we stay 6 feet apart from folks, if we wear our masks, we keep our hands managed, we really don't have a whole lot to worry about there. So it's something that we keep an eye on with all of our testing in the state, but not something I was worried about for Rhode Island.
That's good news. Another question on testing. I've heard this notion from some folks that the PCR test that we're using for COVID might be giving a positive result for the coronavirus, but the person actually has the flu. Is that even possible?
Yeah, no, that's not possible. And why I want to be really clear about that is the test we use for detecting the coronavirus detects the genetic material of the coronavirus, which is completely different than the genetic material of the flu, and that's a whole different test. By the way, Kim, we're not seeing a whole lot of flu in Rhode Island this year, which so far I'm pretty excited about that. Normally by this time in Rhode Island, we'd be seeing a significant amount of flu. That's one of our New Year traditions in Rhode Island is flu. We're just not seeing much flu that year. Part of why I think that's happening, by the by, is we're wearing our masks, we're staying 6 feet apart, and I think a lot of people have gotten the vaccine. So I think that's some good news.
And Dr. McDonald, we're well over 10 months into this at this point. Can you just break down again for us the key symptoms folks should be mindful of I know I need to get a test, or it's a sinus issue, or like how do we break that down again? Remind us of that.
Here's a simple way I think about it is, there's 9 symptoms. Good luck remembering them. Having said this, though, is if you feel like you've got the flu, you got to get a test. If you feel like you have a stomach flu, vomiting and diarrhea, you have my sympathy, but you got to get the test. Feel like you got a head cold? Bummer, you've got to get a test. And I think if you think about it could be a head cold, could be the flu, could be a stomach flu, go get a test. That's how I remember it. Otherwise, it's just too many symptoms for everybody.
Agreed. Thank you for the easy breakdown. We can remember that one. Dr. McDonald, always a pleasure. Thank you for joining us each week at 4.
Can I end on a little positive note? I want to give a little
Absolutely.
personal positive note here. So we do a podcast in the Department of Health called Public Health Out Loud. If you want to hear my wife's successful cancer journey over the last 9 years, go look at our recent episode. It's called Public Health Out Loud. My wife, Gail, gives a great story of how she's navigated through ovarian cancer for the last 9 years. It's an inspiring story. You can see part of why I'm so fortunate to be married to her.
Oh, we love that. Glad to hear that
Will
she's doing
do.
well. Our best to Gail. Thanks, Dr. M.
Thank you.